Hi, I'm Dr. Webb. Over the course of the next few minutes, we're going to be talking about diabetes and how it relates to a lot of health issues, ongoing weight gain, inflammatory problems, neuropathies, etc. We're going to only cover these in very, very brief detail to have a better understanding of if you're insulin resistant now, if you're already diabetic. I want you to first and foremost know that many times here, if not most of the time, this is actually reversible. But I also want you to really understand the risk involved of where your health is going and how it's going to affect you and your family if it's not turned around. So when we look at diabetes, let's say that you're already there. So with diabetes, we have type 2, type 1 and type 2. Type 1 is you're not producing insulin. You don't have the beta cells in the pancreas that are really able to do this. So you have to be on insulin. And insulin is a very important hormone, and if you don't have it in your body, over time you would die. So you've got to stay with that protocol. But even with that, you've got to really understand lifestyle, or over the long run, you're going to run into the same course that most of these kidney or diabetes patients fall into, which is kidney damage, dialysis, neuropathies, damage to extremities, loss of eyesight, cardiovascular problems, and really on probably a minimum of 15 years of your life lost. Type 2 is really what I want to cover though, because your type 2 weren't always type 2. And when we look at diabetes, it starts off with health problems. Now genetics can play a role, but for the most part it's not as big as you might think. Okay, so even if your parents had diabetes, 95% of you at least would be able to look at your relatives and look at what their lifestyle was and understand that their diets and their exercise and overall lifestyle itself wasn't really good for the diabetes. It wasn't pushing the way, they weren't being proactive. So I want you to understand, don't let that get in the way. So with type 2 diabetes, at one time you started really with insulin resistance. So what does that mean? Well, if you take a cell, you have these receptors on a cell, millions of them, and they are going to be activated with certain types of stimuli. Well, when we're trying to push blood sugar or glucose into a cell, you need a carrier, and that's insulin. So you have these basically these molecules that go in and attach to these receptors to allow a response within the cell. Insulin in itself, over time, can actually become, well, desensitized to the cell. If the cell has too many opportunities, if there's situations where insulin is being flooded into the body too much, well, how does that happen? Well, it's your diet. If you're eating the wrong kinds of foods, one of the worst foods today that we see out there is high fructose corn syrup. This should be illegal. It digests very much the same way that ethanol digests in the body, which is alcohol. It can create a lot of damage within our body, our liver, the belly fat, and of course diabetes. In fact, I believe it's probably one of the leading causes, if not in our society today. But these types of foods that we eat, not whole foods, I'm talking about processed foods for the most part, causes this insulin spiking. And over time, if you have too much insulin, these cells, these receptors, become desensitized. And we call that insulin resistance. And when we have insulin resistance, we're going to start having a heightened level of glucose. And so we see that glucose begin to go up. And a lot of you have had your glucose tested, and it'll come back maybe at 100. And sometimes your doctor will tell you, hey, warning, sometimes they won't. I'm going to tell you right now, a fasting blood glucose of 100 is too high. And if you don't correct it, you're going to move in to type 2 diabetes. So we want to look at things on a functional range. We don't want to say, well, you're at 100, and we're not going to call it diabetes until you get to 125. Well, that's just not good thinking. We're going to have to tighten this marker and start looking at things when you're moving that. With my patients, if they're at 95 fasting blood glucose, I'm concerned. And we start working with them with lifestyle and helping make those changes. So insulin resistance, this is where it starts. Glucose is heightened, and because of that, now you're going to start having problems with kidneys. You're going to damage with the filtration system. Insulin itself is going to keep going up higher. And I talked about this in one of my other videos. Insulin is a fat storing hormone. So we start gaining more of this belly fat. And the more fat that you have, especially the belly fat, the more insulin resistant you become. So it's this vicious, wicked circle. So as a type 2, the typical approach is medication, medication, medication. Well, if your choice is not to choose or not to make changes within your lifestyle, then medication is going to be necessary. But I'm going to tell you right now, if that's the direction you go, without really correcting or resolving the underlying problem, the diabetic medication actually over time makes you more insulin resistant, and your diabetes will get worse. And you'll not be on one medication, you'll be on 2 and maybe 3, and then you're head for all these other problems, loss of limbs, vision, kidney dialysis, and again, the whole family's affected. So you can catch this in time, get tested correctly, but the approach is going to have to be lifestyle. And that does require, like in my program here, we teach people everything about how to properly eat. I know you've been told, hey, you need to eat better. But most of the diabetics that I treat, they really don't know. It's not that they don't want to. They've not been told. Exercise is part of it, but exercise doesn't take a lot of time. You just have to exercise. The more muscle we have, the more sensitive we become to insulin. So it's a wonderful, wonderful thing. Cleaning the body, detoxifying the body, and working with other hormones, because there's other hormones that affect this insulin too. We talked about adrenals in one of my other videos. When adrenals are stressed, it increases your insulin resistance. So in brief summary here, I want you to understand that it starts off as insulin resistance. You didn't become a diabetic first. You might have been diagnosed just a few years ago, but you had a problem well before that. And the second thing I want you to understand, that in most cases your diabetes can be corrected. That doesn't mean that you won't ever get rid of it. If you have a genetic disposition, it doesn't mean you'll ever get rid of it, but it doesn't have to be affecting you, okay? Again, don't just look at your parents or your grandparents and say, well, they had it, they were on medication. I'm going to look at also what their lifestyle was. We want to help you with your lifestyle. If you're having problems with weight, belly fat, until that insulin problem is corrected, the insulin resistance, you're in a very, very frustrating effort here with cutting calories and exercise. It's not going to do it. It's part of a program to eat right, not necessarily cut calories and exercise properly, but you've got to get this in balance. So the good news is this: you can make changes, you can turn it around. The bad news, if you don't take action, this is not a wise thing. If you don't take action, your condition will, 100% of the time, it's going to get worse. And you have choices, so I want you to be clear on that. So I hope that helps you understand a little bit, to get more of this information as a whole and learn about hormone stress, belly fat, and overall lifestyle. Check out one of my presentations. You can get that information on this site. We'll see you soon.